So I completed my hand hygiene and I'm going to start the assessment. Hi, my name is Aisa Tudarami. I'm an FNP student. I'm going to be doing a cardiovascular and respiratory assessment on 11-year-old female. I obtained consent from mom. Mom said it's okay to do the assessment. Hello, can you please tell me your name?
My name is Famada Dram.
And when is your date of birth?
October 5th, 2014.
Okay, patient is awake, alert, and oriented ×3. Patient is 11-year-old female, as you can see. Patient is 80 pounds weight, height is 4 feet 8 inches, blood pressure is 100/70, heart rate is 98, temperature is 98.5, respirations are 23. Are you in any pain?
No.
Patient denies any pain. Pain scale is a 0. Now I'm also going to be inspecting the patient respiratory and cardiovascular system. Now I'm doing my inspection. The skin is appropriate for ethnicity. Skin is warm and dry. The lips are moist and pink. There's no nasal flaring. There's no discharge noted. I'm checking the fingers. There's no clubbing noted. I'm now inspecting the thoracic cavity. There's normal symmetrical movements. There's no chest wall deformities noted. There's no masses. There's no masses noted. There's no protrusion. I'm also looking at respirations that are easy and unlabored. There's no use of accessory muscle. Patient is calm. Now I'm going to be palpating, and first of all I will be checking the trachea for any deviation. There's no tracheal deviation noted. The trachea is midline. I'm also gonna be checking the chest wall. I'm gonna be palpating. Do you feel any pain?
No.
There's no masses, no crepidus, no costochondrial tenderness noted. I'm also gonna be palpating for chest wall expansion. Can you please take a deep breath for me? Both fields are equal bilaterally. I'm going to be doing the tactile thermometers. I'm going to say 99 when you feel 99. My hand. 99. Tactile thermometers is normal. There's no excessive vibrations noted. Now I'm going to be percussing the lung field. Resonant sounds are heard across all lung field. There's no dullness or hyperresonance across the lung field. I'm going to be auscultating the lung fields, auscultating the bronchial sounds. Take a deep breath for me. Take a deep breath. Bronchiovesicular, vesicular sound. All adventitious breath sounds, bronchial, vesicular, and vesicular sounds are all clear. There's no wheezing, no crackles, no stridor or rhonchi noted. So now I'm going to go to the back, the posterior portion. I'm inspecting the thoracic cavity. It's symmetrical. There's no bulging noted. There's no masses. There's no lesions. Chest, take a deep breath for me. The wall expansion is normal. I'm also going to palpate for any tenderness and the masses. Do you feel any pain?
No.
It's all within normal limits. Can you say 99 for me?
99, 99, 99, 99.
Tactile thermometers, it's within normal limits. There's no excessive vibrations noted. Now I'm going to be percussing the lung fields. All lung fields are resonant all across. There's no hyperresonance and there's no dullness noted. Be percussing for diaphragmatic excursion. You take a deep breath for me and hold it. I'm going to start below the scapula and percuss all the way down the mid-clavicular line. Okay, exhale. Okay, now you could take a deep breath for me again, okay? Percuss all the way up to the scapula. Okay. Now I'm going to measure, exhale. Okay, it's about 3 to 5 centimeters. Now I'm going to be auscultating the lung fields. Take a deep breath. Bronchial, bronchiovesicular, vesicular sounds. All all lung fields are clear. There's no wheezing, there's no crackles, no wonkai, and no stridor noted. So now I'm gonna be doing the cardiovascular assessment. I'm looking, inspecting like the general skin. The skin is well perfused, it's warm and moist. I'm looking at the face, the eyes, the lips. There's no cyanosis noted. The skin is warm, moist and pink. There's no diaphoresis. There's no pallor or cyanosis noted. I'm also looking at the extremities. There's no clubbing noted. There's no swelling. I'm checking the feet. There's no swelling. There's no edema noted. Looking at the pericardium. Now there's no like heaves or leaks. There's no abnormal chest expansion. There's no abnormal pulsation across the chest wall. Checking the jugular vein for jugular vein distension. I'm gonna be turning her neck at a 45-degree angle, and I'm also gonna be checking it's about 10 to 11 centimeters. So now I'm gonna be palpating the pericardium. Palpating any tenderness, any pain. There's no pain, tenderness. There's no heaves or lifts noted. No pain or tenderness. I'm also gonna be palpating the PMI. It's on the fifth intercostal space along the mid-clavicular line. There's no excessive pulsation noted. I'm checking the carotid artery. Checking the side. Both smooth and strong bilaterally. I'm going to be checking the 6 major arterial vessels, checking the brachial, +2 bilaterally, the radial artery, the ulnar, +2 bilaterally, the popliteal, the dorsal pedis, +2 bilaterally, and the posterior tibialis, +2 bilaterally. I'm now going to be checking the capillary field, the fingers, less than 2 seconds in each capillary field on the toes, less than 2 seconds. I'm checking the lower extremity for edema. There's no swelling, no edema or peeling noted. I'm going to be doing my auscultation now with both the diaphragm and the bell. I'm going to be listening to the aortic valve in the second right intercostal space. I'm listening both to the bell and the diaphragm. Pulmonic valve, the second left intercostal space, the arc point, the third left intercostal space, the tricuspid valve, the fourth left intercostal space, and the mitral valve, the fifth left intercostal space. All the readings are regular. There's no murmurs noted. There's clear S1 and S2 sounds noted. Okay, so now we're gonna see the diagnosis. The CD code is Z00.129. Encounter for routine child exams without abnormal findings. The diagnosis is a normal cardiopulmonary routine pediatric exams. Differential diagnosis is pneumonia, asthma, or congenital heart disease. And we're also going to be talking about anticipatory guidance about cardiopulmonary system. We're going to talk about avoiding like smoke, secondhand smoke, vaping, regular hand washing. We would also talk to mom about staying up to date with our vaccinations like the flu and COVID vaccines. We'll also talk to child about covering their nose when you sneeze with your elbow, when you sneeze or cough, so you don't spread your germs to other people. In the case of asthma, we just want mom and child to be more aware of like breathing patterns like wheezing, excessive shortness of breath, or excessive coughing at night, and just recognizing some of the triggers like dust, mites, or pets in the house. For the cardiovascular, we want to make sure we're having exercise at least for about 60 minutes a day. We are hydrating well. They're eating like nutritious meal, like fruits, vegetables, and staying away from high sugar and high salty foods. And we're also exercising, as well as we recognize some some signs and symptoms, especially during exercise or sports, like chest tightness, palpitations, fainting or syncope, or excessive shortness of breath. For lifestyle-wise and safety, we will talk about avoiding drugs, avoiding vaping, making sure we have our seat belts on, our helmets when we're riding our bikes, and that's it. And this concludes my assessment.